Today is Thursday, April 10th, and I have a very special guest with me today, Mr. Scott Paddock, who is chairman of the Silver Cross Board of Directors. Scott is the president of Chicagoland Speedway and is also involved in many organizations in our community. Thanks for taking the time, Scott. And I think we can take off our masks for the video, and then we are a good 6 feet apart. So thanks for coming here today.
Well, listen, it's me that should be thanking you and your tremendous team here at Silver Cross. You know, we as a board of directors have been closely monitoring what's going on here at the hospital and also throughout the community. And we feel for you and what you're going through. And, we're very concerned about the population base that we need to serve and the patients that we're serving here. First and foremost, Silver Cross is a community hospital. It's a community asset that this community is incredibly proud of. And our mission is to improve the health of the people we serve and to enhance wellness in our community. And that's our mission. And you and your team have certainly been delivering upon that mission, Ruth.
Well, we're sticking to it. And I can assure you everyone here is really doing their best above and beyond, anybody's expectations. Scott, you run a very large business in the sports industry. What's been the impact on the sports industry overall?
What's interesting to me as an observer is, throughout history, in my lifetime, at least, whenever we've had a national crisis, we've always been able to lean into sports and even entertainment as a coping mechanism or at a minimum, a healthy distraction. I can vividly recall post 9/11, shortly thereafter, being in Notre Dame Stadium, watching a football game and feeling the sense of unity and togetherness.
Sure.
And it was cathartic. It was therapeutic being there that day. And we don't have that. This is the first time that sports has been taken away from us and entertainment. And, for someone like me that's involved in sports through my kids, their youth programming, or through business, or as a fan, or as a social activity, that's gone. So that's exacerbated it and you realize people like me and many people in the American population, just how big a role sports plays in our quality of life and our daily lifestyle.
Yeah, I know many people are missing sports on television. They're tired of watching the reruns from the World Series and from golf and everything else. So it's had a big impact. Yeah. And what about your employees? What are you hearing from them?
Yeah, there's a fair amount of angst across our organization. Motorsports as an industry employs tens of thousands of people. It's a multi-billion-dollar industry. And as of a month ago, it came to a screeching halt and essentially no revenue coming in. And so everyone's just kind of wondering, and we don't know when that will end, right? There's no end in sight for the time being. So you've got this whole industry that's really just sitting there trying to figure things out. Thankfully, we've been able through technology to work remotely. And that's been good for a couple of different reasons. One is it's kept us connected to the business so that when the switch does get flipped on, we'll be able to get things up and running again fairly quickly. Right. But also, we've been able to lean on each other. We miss that camaraderie of being in the office, that energy, that togetherness. And we're all going through this and can relate to what one another's going through. So through video conferencing and conference calls, we stay connected a couple of times a week, and it's really helped. But we can't get this behind us quickly enough.
Oh, I couldn't agree more. We're seeing the same thing. A lot of fear, a lot of anxiety. Maybe we're fortunate that people do come together, but they come together under really perilous circumstances. Yeah. So talk a little bit about, if you would, what is the board of directors' role in this crisis?
Well, I think a couple of things. One is to provide guidance, perspective, mostly support. The board, as you know, Ruth, is represented by a lot of expertise across a number of different industries: real estate, banking, higher education, legal. And so, to be able to tap into that perspective, we think is helpful. All of us are experiencing, the byproduct of this pandemic personally. All of our businesses are experiencing the byproduct of that financially. And so whatever we can do to provide expertise, guidance, governance, but mostly our role, I think, is to provide support to give you and your team a pat on the back and just let you know you're doing a phenomenal job, and we couldn't be more proud of you.
Thank you for saying that. And I will say the board of directors here at Silver Cross has been exceptional in their support, in their checking in and being curious about what's going on and offers of help. So thank you, and thanks, sir.
Well, thank you, and thank you for giving me this opportunity, because more than anything, I wanted to come today and represent the board and just thank your team, thank the hardworking staff. We can only imagine what you're going through right now. We know that you're exhausted, and we just couldn't be more proud. You know, we've always pointed to our unique culture here at Silver Cross as what differentiates this hospital from all others, and that's why we wanted to remain independent all of these years, because it's hard to replicate that special culture, and we see that come through in our patient satisfaction scores, and just the pride that we see in the community of having this incredible asset here. So we just appreciate all that you and the team are doing, and you know, we're there for you.
Well, I really appreciate that. What are you most worried about right now? What's on your mind?
Well, in terms of the hospital, it's just the resiliency of the staff. I mean, what the long hours you're working. I know everybody is tired, everybody exhausted, and just to keep up, I imagine they're running on adrenaline right now, and to be able to keep up that pace and that level of endurance is tough. And I know we can't wait to get to light at the end of the tunnel quickly enough, but I think that's my biggest concern, is just making sure, and I appreciate the job that we're doing in making sure that the staff is equipped with what they need from a personal protective gear standpoint.
Right.
Their safety and their health and wellness is what's most important to us. But resiliency, this is a resilient team, and we're seeing that shine through in a big way.
Thank you. You know, you mentioned safety, and I know the board of directors here at Silver Cross is very concerned, always monitoring safety. We've won the Leapfrog A for many times. So it's really important both for our patients and our employees.
No doubt. When I talk about our culture, safety is embedded in our culture, and that emanates from the leadership at the top and the commitment by the staff. And you mentioned the A's we received on the Leapfrog Award. I know we've gotten a number of stars through the CMS program. So we have a committee here that's represented by a number of doctors and the subset of the board of directors focused specifically on quality, and safety is a big part of that. And we're seeing the benefit of that commitment and institutionalizing that commitment to safety within our culture, and how it's paying dividends during a crisis like this.
You know, you're really right. The safety journey we've been on and all the habits we put together, they are so helpful right now as we've approached this, because we know what it means to be a safe institution. So is there anything else, Scott, you'd like to add?
Just thank you. You know, we're praying for you. We couldn't be more proud, and your community could not be prouder of the job that you are doing. You know, the Silver Cross is always a model and something that a good corporate citizen, a great asset in the community. And in times like this, unprecedented times like this, we're seeing the important role that we play as a community hospital, and we as a board and we as a community could not be more thankful and appreciative of the job you're doing for us.
Thank you. Thank you so much.
Thank you.